Hello, welcome to the Thyroid Pharmacist Healing Conversations podcast. Today, we're going to be talking with thyroid advocate Rachel Hill all about having a healthy pregnancy, postpartum period, preconception period when you have a thyroid condition. Thyroid conditions can make fertility more challenging. There are higher risks of miscarriage, infertility, so on and so forth. And I know for many of us, when we hear that, that can be quite scary. I know for myself, when I was first diagnosed, I came home like crying because I thought I was never going to have children. Spoiler alert, I have a beautiful 7 year old, and Rachel has two beautiful children and also a new book coming out.
Yeah, so it's called the Positive Thyroid Pregnancy Book, and it covers, like you said, how to have a healthy fertility, pregnancy, postpartum, and then going into parenting as well. That whole stage of your life when you have a thyroid condition.
Yeah, it's a big deal, and I feel like having a thyroid condition, we do need to prepare for it a bit more than somebody without a thyroid condition, but it's still absolutely possible. I'm going to share a little bit about Rachel, her background. Rachel Hill is the multi award winning thyroid patient advocate, author, speaker, and content creator behind The Invisible Hypothyroidism. You may have seen her on Instagram or read her newsletter on Substack. Her thyroid advocacy work includes writing articles, authoring books, producing her thyroid family email newsletters, appearing on TV, radio, and podcasts, and speaking at events about the many aspects thyroid disease affects and how to navigate them. She's well recognized as a crucial and influential contributor to the thyroid patient community and has a large social media presence. Her best selling books include Be Your Own Thyroid Advocate, You, Me, and Hypothyroidism, and the children's book, Thyroid Superhero, which I was very excited to share with my son. So, welcome, Rachel. It's so great to have you here with us.
Thank you so much for having me. I'm so excited to dive into what I hope will be some really helpful discussions today.
I know that it will be. There's so many women that ask me, I'm trying to have a baby. I'm really nervous. I've heard there are fertility challenges with thyroid issues. And so I'm really, really grateful that you are speaking about this topic and that you've taken the time to really go deep and create a guide for us. Now, I'd love to ask you, what inspired you to write the book and how does it differ from your previous work?
Um, Really, it was from me going through this experience myself. So my first son was born 5 years ago now. So it's been almost 6 years, well, 7 years since I embarked on starting to try to conceive, 6 years of being pregnant. And through both of those periods, through trying to conceive and trying to optimize my fertility and understand what was in within my control within that, and then also going through pregnancy, I just found that there was such a lack of accessible information, both within books and online. No matter what I Googled, what I tried to look for in books, I couldn't quite find the answers I needed. And a lot of that was really just what can I do to look after myself and what can I do to nurture this pregnancy. My first pregnancy, unfortunately, ended in a miscarriage when I was about 6 weeks pregnant. And although it was quite early on, like a lot of today's listeners will be aware of, it's still a very painful experience, especially if it's a pregnancy that was very much wanted. And so going through that, then trying to optimize my fertility for over a year before trying to conceive again, going through his pregnancies, and obviously all the stumbling blocks and questions not ending there. I found I was just learning so much, I guess, quote unquote, on the job, that I just felt other people need to know as well, because I couldn't be the only person who was scared and confused and feeling alone and just needing this information. And through sharing, as I do, my journey online, I realized that I really wasn't the only person. And so that's why over the last 5 or 6 years, I've plugged away at putting together this book, with all the nuggets that I've learned along the way. And yeah, to just kind of create the resource I needed that I'm sure so many other people need as well.
Thank you so much for creating these resource. And I know it probably wasn't easy taking care of children, trying to write it all down in between changing diapers and feedings and waking up throughout the night. So we really do appreciate it. I know that a lot of women, I mean, I know I was just so overwhelmed thinking that, will I have a healthy baby? Will I have a healthy pregnancy when I was first diagnosed before? Like you said, there wasn't a lot of information. There was just information about how it can be so much harder to have children when you have a thyroid condition. And I know I've spoken to women in their 70s who were never able to have children because their thyroid wasn't optimized. Um, can we talk about some of the biggest misconceptions, maybe fears that people have that you hope to ease with this book?
I think the number one is that we can't have children, or we can't perhaps have a healthy child at the end of it. One of the things I kept coming up against when I was researching was rates of congenital hypothyroidism, autism, developmental delays. And a lot of the time, what the risks of that often come down to are simply having an optimized or optimally treated thyroid condition. So, mainly talking about hypothyroidism and Hashimoto's here, because that's what I have personal experience of. As long as your thyroid hormone levels are optimized, and we're talking about more than just falling within range, as we might talk a bit more about later, and with Hashimoto's aiming to try and bring those thyroid antibodies down and controlled, then really the chances of having a healthy pregnancy are not all that too different to other people. And so I think the biggest misconception is that we either can't have a child, we can't fall pregnant, um, or that we could, but it will be a really tough experience. And I guess that's where the name, the Positive Thyroid Pregnancy Book, came from, because I wanted to just reassure people that we can, as long as we have the information that we need and we focus on the things that we can control, that are within our control. Um, there are certain things that we can do um, to optimize those chances, and there are discussions that we can have with our doctors, and there are certain guidelines we can refer to and questions that we can ask that help us feel in control, and to then kind of guide us through those. In the book, I call them steps that we can take to feel like we're doing what we can.
The challenge is I feel like some doctors might not know this information. Uh, I was personally surprised to learn that fertility, like thyroid function, isn't a screening test that they would do before women try to get pregnant. And sometimes women would go through on a fertility journey before, and they would have all this blood work done, but they wouldn't be tested necessarily for their thyroid function or even thyroid antibodies. And of course, there are some doctors out there that's the first thing they'll look at and they'll make sure we're optimized. But not all doctors are created equally. And it's so important for us to be able to understand our condition and advocate for ourselves and know the research, know the guidelines, and be able to have that conversation with the doctor and say, you know what, actually, this number that I have, for example, TSH of 8, most doctors might say you don't need treatment for that, right? If you're in the early stages. However, if you're trying to conceive or you're wanting to have a baby or a healthy pregnancy, you want to get that number much, much lower. And we'll kind of get into the details because that's going to increase your rates of fertility and reduce your chances of miscarriage. So the reference ranges for pregnancy and fertility are going to be much tighter. And there's a lot of research to support that. Now, you cover fertility, pregnancy, and postpartum, right? And then also parenting. Now, these are very different stages. Um, they're all intense stages, I would say. How do you structure your book to support women throughout their journeys?
So it's broken into three key parts. So part one is fertility, and that also covers things like, how do you know if you're ready to have a child when it comes to your thyroid condition specifically. Is your thyroid condition under control? Are you having many flares? Do you need to look at how, when you fall pregnant, that might cause more flares, how that might impact your work. It really looks at our whole lifestyle and management. So we have fertility, and then the second part is, you're pregnant, hooray, what do we do now? What do we ask the doctor? What can we do ourselves? And then the third part is, you've had your baby, now let's figure out how we're going to navigate that, because your thyroid condition doesn't go away. And in fact, it often flares up after you've gone through pregnancy and childbirth. And as you touched on, there are sleepless nights. There's a very demanding small human that needs you all the time. You might be trying to breastfeed, which can in itself be quite tricky as well. There is a lot that we're then navigating when you fall pregnant and when you have a child. Your thyroid condition doesn't disappear. It does flare up for a lot of people. So we're also talking about what we can do to feel like we are in control of that, and almost in a way to expect it to flare up for your, and when I say that, I mean your thyroid hormone levels to go higher or perhaps swing between being too high and too low, or for Hashimoto's to come out of remission, which it did for me, which is very common. And to, if you can expect that, then you can put some things in place, like preparing to get back on the phone to your favorite doctor, your functional medicine practitioner, to start certain, I guess, like interventions that help to get that back under control, and have some like go-to protocols, for example. So yeah, it's about sort of being prepared. People can dive straight into a specific part depending on where they are in their pregnancy. Um, Otherwise, just reading all the way through gives you the full idea of what you can do overall, which really it just comes down to looking after your thyroid health and everything else that often comes in balance with that, which I often referred to as the thyroid jigsaw puzzle. So, your adrenals, your gut health, your nutrient levels, your diet, stress, exercise, all of those things as well.
I really appreciate you putting all of these life stages in a book because I have a confession. I read all of these books about fertility and how to get pregnant and all of those things. And then all of a sudden I got pregnant and I was like, wait, what do I do? And then I got into like okay, what do I do now that I'm pregnant? So it was a very steep learning curve. And then I just didn't even have time to like focus on postpartum or parenting. So I appreciate you putting this all together in one book because we don't realize how quickly it can go, right?
Yeah, exactly. It's all together. It's in one book, and it's not a big book either. It's quite a fast read. You can read it within 3 or 4 hours. And as I've suggested in the book as well, get post-it notes, get a highlighter. Put a post-it note on the pages that are relevant to you. Highlight the things that you want to ask your doctor, and really make it almost like a workbook. So again, you're advocating for yourself. You're learning which areas you can take control in, and then you can be proactive in that.
Yeah, for sure. Let's start talking about thyroid hormones. We often know that we need to have the thyroid optimized before we get pregnant, right? So that's going to help prevent miscarriage. And then after somebody confirms the pregnancy, there's most of us do need to increase our dosage. Can you walk us through this a bit?
Yeah, so obviously before pregnancy, looking at optimizing your thyroid hormone levels just means that your body is in the best place possible to then go into that, already prepared and already where it should be. Depending on what kind of thyroid hormone medication you are on. So I had, with my two pregnancies, I was on Armour Thyroid alone for one, and I was on Armour Thyroid plus a small amount of levothyroxine for the second. After having my first child, my needs changed, and there was a lot to navigate with that. But for a lot of people, they're on levothyroxine or Synthroid or another T4 synthetic alone. For a lot of people on those just T4 medications, they find that their need for medication increases quite quickly. And as standard, a lot of doctors will increase by sort of 30 to 50%. They'll probably have like their own specific number depending on your levels and their experience. They will often immediately increase on this. And if you are on a medication like that, it's well worth having a discussion with your doctor when you're trying to conceive or thinking about trying to conceive, to say, hey, if I fall pregnant and I find out on a Friday and I can't speak to you until a Monday, do you want me to increase my medication in that interim time? And that's a really good discussion that we can have just to keep on top of that. I know for me, each time it took a week to see my doctor between finding out I was pregnant. So already having had that discussion, we both knew what to do and what to expect in that time. But if you're on a T3 containing medication, so that could be liothyronine, like Cytomel, or an NDT medication like Armour Thyroid, typically they don't always tell you to increase that straight away because of the T3 content. Your body, it just kind of uses it slightly different in pregnancy. So I know that for me on Armour Thyroid in my first pregnancy, where I was on just Armour Thyroid, it did not need increasing until I was about 30 weeks pregnant. My levels stayed completely optimal for that long. And even then it was a very small, sort of like 15% increase. And then in my second pregnancy, the Armour Thyroid stayed the same throughout, but my levothyroxine dose changed 3 or 4 times throughout throughout that pregnancy. And the levothyroxine needed increasing very early on. So true to what we expected and what my doctor walked me through, yeah, that sort of played out as we expected. But this is a part that you often don't hear about, is how different medications can react in pregnancy, and the roles of the different thyroid hormones. So T4 is primarily for baby. That is the medication. That is the thyroid hormone that passes the placenta. You do need enough T4. Um, we do run a risk of T4 being demonized a lot in the thyroid community, which I'm very hesitant to do, because a lot of people do well on it, and it is important in pregnancy. But then often T3 is really important for the mum. It's what the mum can use. It's what makes mum feel great. And let's be honest, pregnancy with or without a thyroid condition is tiring. It's exhausting. You can have a long list of symptoms. So we also want to be keeping in mind that mum needs being looked after as well. So yeah, looking at optimizing levels and then keeping those optimal in pregnancy, paying attention to that first trimester, especially before babies develop their own thyroid gland. That time is crucial, as so many of us are already aware, in terms of miscarriage rates and other complications. So yeah, just having a bit of a plan with your doctor, depending on what type of thyroid medication you might be on, that can be really helpful.
Yeah, I agree with you. I was on natural desiccated thyroid during my pregnancy with my son and looking at my levels. And I was like, okay, I found out I was pregnant and I was like, let's get my thyroid tested and let's talk about increasing the dosage. And typically our T4 can get a little bit, I would say, borderline. And
Yeah.
I needed to actually just take a little bit more T4 medication in addition to my dosage of Armor. Was it Armor? One of those natural desiccated thyroid meds that I was on at the time. And getting a little bit of tyrosine on board helped me to get that T4 level in that top half of the reference range, just to make sure that the baby was getting enough of that. And some doctors, I find, they may not be as knowledgeable with natural desiccated thyroid. So they might look at your numbers and they might say, oh, well, looks like your TSH is low. And I feel like as thyroid patients, we really do need to understand our own numbers and understand our own medications just so that we can advocate for ourselves. And I've heard
Yeah.
people saying, okay, make sure if you are planning a pregnancy that you have that slip for getting your labs drawn. Maybe you have a prescription on file with your pharmacy so that you can get on those meds, right? You don't want your doctor to be like in the Bahamas on vacation for 3 weeks and you need a dosage adjustment and you can't reach them.
Yes, definitely. It's one of the other sort of tips that I mentioned in the book that I had with my own doctor, is that when I confirmed I was pregnant, he agreed to basically write a prescription for 9 months worth of my medication, its current dosage, that I could essentially have stockpiled in my cabinet, so that I knew, especially being on Armour Thyroid, there'd been a couple of recalls at the time. I just knew it was there. I had it. I could get through pregnancy without worrying that I would go without a certain medication or anything like that. If you have concerns, voice them to your doctor. They often can help you work around that. And yeah, just kind of find what works for you in your situation.
I'm a big fan of stockpiling because we all know that pregnancy can make us a bit tired and forgetful. We have that pregnancy brain, so just having some extra meds in your house, your thyroid meds, so you don't forget to get a refill is really, really great advice. Now, are there any kind of key nutrients or lifestyle strategies that you have found can be very, very helpful for perhaps getting pregnant, maintaining a pregnancy, or maybe feeling your best, right?
Yeah, I think in terms of nutrient levels, and this is arguably like the second most important thing after optimizing your thyroid condition, because so many of us have low vitamin and mineral levels with hypothyroidism. You can look at vitamin D, iron, folate. Those are sort of the key ones. B12, in particular, vitamin D and iron are really important for pregnancy. And if you've got low levels to begin with, again, that could impact your chances of falling pregnant. And then when you are pregnant, you need enough of those to contribute to the healthy development of baby, of everything that your body is creating. And then In terms of other sort of lifestyle strategies, you want to make sure that you are keeping active. Ideally, a range of exercise that is involving sort of cardio, which doesn't need to be really, really crazy. It can be going for walks every day, a half an hour walk every day can be great. Outside in nature gives you so many extra benefits as well, and you get that extra vitamin D through that too. But if you can also get some strength training in there, yoga is brilliant just for sort of stretching the body out, and also then tying into looking after your adrenal health and promoting good sleep. There are so many things that we can do to optimize our health when we are trying to fall pregnant, and therefore optimize our fertility. But also, then when we are pregnant, it's so much easier to maintain those practices instead of starting them in pregnancy. A lot of sources will recommend not, for example, starting a new type of exercise in pregnancy. It's recommended that you are well established, whether that is strength training or running beforehand. You probably don't want to be changing anything once you're pregnant. You don't want to risk destabilizing your pregnancy either, which is also why a lot of doctors will not change the type of thyroid medication you're on once you're pregnant. So it's worth keeping all of this in mind, that fertility stage, that the idea of having a preconception plan, so optimizing your health beforehand, can be so important, and it shouldn't be skipped. We want to be optimizing things to fall pregnant, yes, but we're also laying the groundwork for what we're going to continue doing through pregnancy. And then once your baby's here, again, you want to be looking after your health and making sure that you are in as good a place as possible to deal with if your thyroid levels are going up and down after giving birth, or the baby has you up all night and you might have other things going on. So yeah, it's often about sort of laying this groundwork to optimize our thyroid, optimize our vitamin levels, look at our exercise. We want to be exercising enough that we're feeling good, but not so much that we're perhaps taking a step backwards in our thyroid health. It can be really easy to overdo things. A lot of patients have come to me saying that I just can't get the balance right. And it often comes back to just reassessing, in terms of exercise, your frequency, intensity, and duration. That it's often a bit of a balance, and no two thyroid patients are the same. So yeah, you want to be looking at those things and just making sure that you are promoting more energy, less symptoms, good adrenal health, less stress, and that you're going into it with with these important building blocks.
Mhm. Yeah, I was personally surprised when I was pregnant because I remember my legs hurting because it's like that extra belly.
Yeah.
I wish I had done a little bit more like leg training and focusing on that throughout pregnancy. Not extreme, but just I was like, wow, that you actually your body changes so much. And I wish I had known about that. And I also wish I had known about ferritin and really
Mhm.
optimizing my iron levels. So I became anemic. You know, many women with hypothyroidism have low
I
levels
did too, yeah.
to begin with. And I went into the pregnancy already kind of borderline and became very anemic. I had these crazy cravings for burgers where I would cry if I didn't eat 2 burgers a day. And, kind of had like a lot of the emotions that come along with pregnancy that are considered normal pregnancy emotions. And then I got my iron restored, and I was like, I feel so much better. I'm sleeping well at night. I'm not having restless leg. I'm not, I was still emotional, but not like overly emotional where I would cry if I didn't eat a burger. And those vitamins can make such a big difference for the baby and then how you feel throughout that pregnancy.
Yeah, exactly. And it sounds like your body was just screaming at you. It was trying to tell you what it needed. And it's so important to listen to that.
Absolutely. So you had low iron as well during your pregnancy?
Yes, more so my first, because I went into my second a bit more clued up. But yeah, in my first pregnancy, my iron was actually really good until I got to, I think, around the third trimester. And then it suddenly dropped. For those listening, your body just demands a lot more when you're pregnant, especially for the growing baby. You have like a lot more blood circulating. You've got the growth of the and maintaining the placenta, so your body does need a lot more. And iron should, along with me feeling like every woman should have their thyroid checked before they try to conceive, I feel like iron should be one thing that's just routinely tested throughout pregnancy, because for many women it will be good, and then suddenly you will hit like the third trimester where a lot of like the fatigue returns and the demands go up, and it plummets and it drops, and that's really common for a lot of women. And like you say, there's such a crossover between, is this tiredness and fatigue and brain fog from my thyroid, from iron, or is it just a pregnancy thing that, my body's going through a lot? So you can kind of expect that to a degree. And it's really hard to know what might be coming from where. So I just really urge people to ask the questions, get the test done, rule things out. Because yeah, it's important for you to feel good as well as for your baby to develop properly. It's really important that mum is looked after as well.
And it's so important too in the postpartum because if you don't have enough iron on board, that could lead to just being exhausted, even with depression. Do you have suggestions on how to get perhaps iron levels supported if you are found to be deficient, or how to get your body ready?
Yeah, so I mean, obviously, we can look at ingesting more iron in the diet. As you touched on, sort of meats, especially red meats, are really good for that, whether it's 2 burgers a day or a different form. I personally like to throw a lot of spinach into pretty much anything I'm eating, and that is something I still do to this day to keep my iron levels up. But in terms of supplementation, because sometimes diet will only go so far, especially when it comes to pregnancy and the demands. A lot of people struggle with ferrous fumarate and some of those other, I guess, like more cheaper forms of iron. Iron bisglycinate is tolerated better by a lot of people. It's generally non-constipating. It shouldn't cause nausea, and it's safe. It's safe to take throughout pregnancy as well. So iron bisglycinate is the form that I always go back to. My iron levels were very low back in January of this year, so a couple of months ago. I think the normal range here was sort of 20 plus. We know being optimal is much higher than that, but my levels were like 7 or 8. They were very low. And within 8 weeks of supplementing iron bisglycinate, I'm now up to like 60. So I'm getting there. It's been very fast. But taking it with vitamin C, that's a very simple small hack that a lot of people don't know about. But yeah, if you take iron with vitamin C, you will absorb so much more of it and you will likely see your levels go up even quicker. But you just want to be careful with iron because, pregnant or not, taking too much when you don't need it can cause more issues. So yeah, just always test and always just make sure that you do actually need it, and then test, every 6 to 8 weeks after changing dose, and just check in to make sure that you do still need it.
Yeah, that's such great advice. And I know that a lot of women complain about the constipation with taking iron supplements. And a lot of women, like you said, pregnant or not, with Hashimoto's, with hypothyroidism, they might struggle with low iron, low ferritin levels, which is the iron storage protein. So that's really great advice. And I find that can be very helpful for things like postpartum hair loss, even. That can be a
Yes.
really, really big game changer. Um, we should talk about mental health. I feel like we know postpartum thyroid issues can be associated with postpartum mental health issues. Can we talk through some of that and maybe some of the strategies people can utilize?
Yeah. So and I always say it's really controversial to say, but postnatal depression, even antenatal depression, if you're feeling it during pregnancy as well, can be from low thyroid hormone levels. And that's not to say that they are not real mental health conditions in their own right. They are, but there can be many causes for them. And if your thyroid hormone levels are low, namely free T3 in a lot of people, if your iron, B12, which is not talked about often enough, vitamin D, if any of those are low, they they generally will cause symptoms of depression. Sometimes anxiety too. It can go hand in hand. If depression is impacting certain parts of your life, you may then feel anxious off the back of that as well. But if you are struggling, whether you are pregnant or you're perhaps a new mum, or perhaps your baby is a year or so old and you're still struggling to get out of the fog of just feeling so low and feeling as if every day is a struggle, then these are the key areas I would recommend exploring. I think looking at it holistically, there's also, I think these days, such a lack of support for new mums, especially. You look sort of 50, 60 years ago, your aunt would live next door and your cousin would live across the street. And we had such a tribe of people there to help us raise families, and we would raise them together. And that's not to say that life was so much better back then, because we know that so many other things have improved since then. But this is one of those good things that we've lost, and women don't always have that tribe around them. So as well as looking at your physical health and and ensuring that all those things are optimized and ticked off. Also finding ways to connect with other new mums. And for me specifically, I found it really helpful to connect with other mums that also had health conditions. And they weren't necessarily thyroid conditions. In fact, I don't think any of my other close friends have that, but they will have like PCOS or other health conditions that we can just relate to each other on. So if the other one is having a particularly tough time with their symptoms, I might take both of the children to the park. We can help each other out. We can drop nutritious meals off at each other's doors. And if you're not necessarily close geographically, having that online support where you can connect in online groups and forums, or yeah, it can make such an impact as well as addressing your physical health. So doing things to look after your mental health, your well-being, and embracing this new chapter that you're going into, because a lot of what we don't talk about when a woman has a baby is this kind of metamorphosis that she goes to become almost a brand new person. You're still fundamentally you, but you do change. Your priorities change no matter how much you try, and not let this small human take over everything. Your life does change, and that's okay. And we also need to be mindful of encouraging women to embrace that, and just kind of find their way through the fog as things settle, as we create new routines, new expectations, and just supporting their mental health with that as well. Yeah, I just urge people to be cautious about parenting information online, especially with social media, because I think a lot of the time it's presented in a very, oh, this comes so easily for everyone. Children are really sort of happy all the time, and they're not. They have their own feelings just like we do. And some days they're struggling a bit more, and that means that more is demanded from us as a parent. And so it's this idea of things being quite fluid as well. So find your tribe, as well as optimizing your physical health, and just do things that promote good mental health in you. If going for a run is what brought you joy before having children, it's probably going to be the same thing that does after. So find ways to carve out that time, whether it's going when your mum looks after the kids, or perhaps when they're in bed, or if your partner can do bedtime and you spend that time picking up a book or watering the flowers in the garden, whatever it is. I also talk about that as well, because yeah, it's not just about our physical health. It's about nurturing those parts of us and that part of our mental health and our well-being as well.
Mhm. I learned so much on my journey postpartum, and I learned how sometimes postpartum depression can happen because you don't have enough support. Sometimes it can happen because you don't have enough sleep, right? Sometimes you don't have enough thyroid hormone, so you might have postpartum flare ups, or some women get new onset postpartum thyroiditis. Maybe you were controlled well before, but all of a sudden something happens. The stress of the pregnancy, the sleep deprivation, just the big lifestyle change. It's a lot to expect. And if you don't have a lot of people in your life that are supportive, I know I had my mom come and stay with me from Chicago. We were living in Colorado, and that was really so incredibly helpful. I know postpartum doulas can be a really, really big game changer, having those meal trains. And one tip that I've shared with some of my new mom friends is you can get a phlebotomist to come into your house, to come and visit your house to do your blood work, right? You don't have to like necessarily leave the house to get blood work, because sometimes in that newly postpartum period, like just leaving the house can be a like very, very big production. It's like, you're leaking milk here. Are you gonna have enough time to pump? Who's gonna feed the baby? Is the baby taking bottles? And sometimes just having people, there's a lot of resources that can come to your home, and just being mindful of that can be a really, really big game changer for a lot of people.
Yeah, I think a lot of the time, if we can step back and just reassess what are the things that I'm finding really tricky, and what are some simple ways that I can break that down to make that easier. So, like say that's a great example. Another thing I recommend is that when you're pregnant, dedicate a weekend or two to batch cook bean chilies and sauces that you can use that you can throw with chicken to make a curry, like batch cook nutritious things that can go in the freezer and survive in the freezer for a couple of months. Honestly, it was like my best piece of advice for both of my pregnancies and postpartums, because myself, or usually my husband, because I was nap trapped or like breastfeeding trapped with a baby on me, he could just grab something out the freezer, heat it up, throw some veggies on the side, and we had a much more nutritious meal than if we called for a takeaway or, grabbed like a frozen pizza from the freezer or something that would be is equally easy to do. But by just putting that little bit more prep in beforehand, it meant that I was eating more nutritionally to try and keep my thyroid and my Hashimoto's more stable, to promote keeping things like fatigue and constipation at bay, to keep my vitamin levels up so that I could show up as a more physically and mentally healthy mum for baby in those early days. So again, there are some really simple hacks that we can do that don't really cost anything. They just need a little bit of preparation, and it can make such a big difference. So that's like another top tip that I would recommend everyone does.
I love that tip. I think that can be such a big game changer. I know I remember eating so many soups postpartum and they were so soothing. The My biggest challenge postpartum, I did not expect. I've always been a very good sleeper, and then I read these books that said children can sleep through the night at 3 months. My child didn't read that book.
Yeah.
The sleep deprivation, that was a really, really big challenge for me. I'm curious how you've gotten through that and what are some points of advice that you might have for moms and dads?
Yeah, so I think, and unfortunately, it is highly frustrating they don't read those books before before they arrive. Really convenient if they did. So I've got two boys. They're now 5 and almost 3, so slightly older, and they pretty much sleep through the night now, thankfully. But both just naturally very different sleepers. My firstborn, I thought was a bad sleeper, but around the time he was 4, 5 months old, he started sleeping through for 12 hours. It was brilliant. He would start the day at 7 o'clock. I thought that was early. And then I had my second, who was waking up through the night until he was like 1.5 routinely, and would also go to bed later and get up earlier. So we were starting the day at 5:30 for well over a year. And that on my thyroid and adrenal health was really, really rough. I think as they got older, obviously, they do learn to sleep better. I think as well, you will have this debate about sleep training, whether that is the more hardcore sleep training or gentle sleep training, however you go about that as well. For us, we did implement some of like the gentle sleep training approaches, staying with them until they were asleep, but trying to gradually withdraw that. And you can explore things like that. I think in terms of focusing on what is within your control as well, you can focus on getting to bed earlier. So I would often work backwards. So I know that my body needs about 8 hours, 8.5 hours to feel good and well rested of sleep, that is. So if my little one was getting up at 5:30, I would count backwards and figure out which time I'd need to be in bed for. There are things like that that are within our control. We can also talk to our partner about tag teaming. A lot of people split night wakings, whether that is you getting a chunk of sleep for the first half of the night and then you swap with your partner and then you're the one responding to wake ups. There are various ways that you can go about it. Some people may be able to get hold of like a night nanny or a family member to stay with them to help with those things. Obviously, it's not accessible to everyone. So we just want to focus on the things that we can control. So if you need to nap when your child naps in the day, that's fine. Get your sleep that way. If you need to head bed earlier, even if that's 8 p.m., that's fine. It's not going to last forever, but I think just focusing on what you can do in the moment can make such a big difference. And as well as heading to bed, a lot of good sleep starts with that hour or two before we actually get into bed. So looking at turning away from screens, turning bright lights down to warm lamps. Again, focusing on what kind of brings you joy in a relaxing way, whether that is reading, taking a bath, giving the flowers a last water outside. A lot of people love to be outside just before they go to bed, the fresh air, kind of like taking in the fact that the world has gone dark, the world is going silent. It can really just help soothe you and feel ready for bed. So whatever that is, if you can work that in as well, obviously around young children and babies, it's not always easy. I do try and get mine to be a part of that as much as possible. And just know that it does get better, but focus on what you can control. If you're in that sleep deprived state, you're probably not in the best place to go for a 5K run every single day. So rein it in and think about walks and yoga and just where your energy is best well spent. Yeah, and just again, just repeat to yourself, it's all a phase. It doesn't last forever. I just need to get through this season of life.
Yeah, I think that's really great advice, and just being kind to yourself during that period and not expecting yourself to have a perfectly clean house, or, be really crushing it at work, or having going to the gym for 4 hours a day. I think sometimes it's like, okay, this is something that's happening, and I'm going to take the time to try to do my best to take care of myself, because when I take care of myself, everybody gets better care as well, right?
Exactly. Yeah.
I know people say sleep when the baby sleeps, and then there was like a meme going around like, do laundry when the baby does laundry. And I do find napping with the baby, like sometimes you just need to do that. And if the laundry doesn't get done, then the laundry doesn't get done, right?
Yeah, it's like we said, it doesn't last forever. It's about just taking it day by day, especially in those really early days when they're a small baby. They won't have routines. And I think when I was pregnant and reading pregnancy books, I had fallen for this idea that we would have a routine, that we could enforce them to be asleep by a certain time, and they just don't until they're that much older. And it's so much easier if I always say, give in to the madness, give in to the chaos, go with it. You will figure it out, and just know that it will get better. But focusing on what you can do to look after your health and your thyroid condition in the meantime, such as by looking at what you're eating and how you can simplify that and make it easy to eat nutritiously. Set reminders for your supplements, your medications. You've got to make sure you're on top of those if you want to give yourself any chance of feeling good as well. And yeah, just optimize your sleep. You probably need more sleep than you think you do.
Ain't that the truth? um, Whenever I write my books, and I always do a lot of research, and I know you do as well. And there's always things that I feel like, okay, yeah, I already knew this, but there's always some things that surprise me. Was there anything that surprised you when you were doing your research for the book that maybe you perhaps didn't know, or that's not a commonly known fact?
Oh, that's a really good question. I think probably that if you have Hashimoto's and you have antibodies, that a lot of experts now believe that antibodies can cross the placenta and possibly attack your baby's thyroid gland. And I think, again, coming across a claim like that can be really quite frightening. So we look at that in the book and we talk about what we can do to try and keep Hashimoto's either under remission, or if you're now pregnant, it was never under remission, just looking at what we can do to try and keep them as low as possible. So whether that is through dietary changes, a big one is gluten for a lot of people, perhaps soy, dairy, exploring those, as well as preconception and things like alcohol, and caffeine as well, which by no means people I don't give, I'm not in the position to give people this like wide dietary advice, but by exploring, for example, with an elimination diet, which things might help, and how you can figure out if those things might help, then that can contribute to lowering your thyroid antibodies or just trying to keep them as low as possible. Stress levels, your gut health, such a big piece, for a lot of us is our gut health as well. Exploring all of these, as I know you talk about a great deal as well. Yeah, you can come across a scary claim like that, and you can sort of run wild with it and let it really make you feel fearful, or you can look at it from a different point of view and think, what can I do to try and at least control an aspect of this? So, yeah, that was one thing that really sort of shocked me through navigating this myself, and I just had to step back and think, well, getting anxious is going to do nothing good for my pregnancy. What can I do to try and manage this and control this? And that was so much more useful. So yeah, that would be the thing that kind of surprised me the most.
Yeah, I think that's so empowering to have that stance of what are the things that are within my control and what's outside of my control. And, is being anxious about something, is that really going to help? The thyroid antibodies, of course, can make us more anxious. Like having them can make us more anxious just in general. And there is a lot of research suggesting that their presence alone may increase various risks, with fertility. And some doctors I know will even give women small doses of thyroid hormone, even when their thyroid function is, more within quote unquote normal, just when they have those thyroid antibodies present. One thing for me that was a surprise, and I'm not sure, I would love to know your story and your journey with this, was I didn't realize how challenging breastfeeding would be. I thought like it was just an instinct and it was so easy and then it just happened. And man, was I wrong about that.
Yeah, I feel like that's the case for a lot of us. I did so much reading when I was pregnant. Breastfeeding was absolutely something I wanted to do. No one was going to change my mind at all. I did so much reading about the correct latch, about promoting breast milk production, absolutely everything. And it just didn't really work out for me. With my first son, I breastfed for the first 3 or 4 months of his life. And essentially, it's a skill that both mother and baby need to learn, right? I think you kind of go into it thinking, well, a baby needs to know how to do it to survive. So they'll know what to do and I'll know what to do. And it's right there. You just pop them on and off you go. And it really wasn't. He couldn't quite figure out how to latch correctly. I was producing a lot more milk than I needed. So those issues combined meant that I had mastitis when I was only 4 days postpartum, which quickly became a breast abscess. So at that point, I was going to the hospital on a weekly basis to have the infection drained out, which was a whole thing of its own. I was on constant antibiotics. This was for 3 or 4 months, and they kept changing the strain because they would take a sample to determine which strain I needed. It wouldn't really work. They'd tweak it a little bit. Essentially, we could never really get it under control. And at the time as well, we'd just gone into the first lockdown here in pandemic in 2020. And it got to a point where my mental health, as well as my physical health, because my gut was the worst, my gut health was the worst it had ever been. It just got to a point where I had to say, this just isn't working. I can't do it anymore. And I think around the same time as well, we also found out that part of the reason he was such an unhappy newborn was that he also had a dairy intolerance. So he couldn't digest dairy, which his dad is lactose intolerant. So it makes a lot of sense. And obviously, I'm fine with dairy. So consuming it, going through my breast milk, and even that small amount that he was getting was enough to be causing him a lot of digestive issues. So for us, the solution was to move him to a non-dairy based formula. And it was honestly one of the best things, one of the best decisions I've done with parenting, which at the time I could not see at all. I grieved for a long time that process of it just not working out and it didn't go how I wanted it to. And could I have done something differently? And I think ultimately things work out a certain way because they need to. And there was a lot that I needed to learn through that experience. And then when I had my second son, because I was carrying so much trauma through what had happened only less than 2 years before, I knew I wasn't going to breastfeed, but I did hand express and pump breast milk for a while. So for the first month or two, he was combi fed from a bottle, breast milk and formula, and eventually we moved on to formula. And honestly, looking at them now, you would not know there was any difference between the two of them. We know the benefits between breast milk and formula. And if you can and do want to breastfeed, that breast milk is going to do so much more for their health, for their gut health. But at the same time, if it's at the expense of mum being able to be mentally and physically well and be present for that child, it's such a bigger conversation that we need to have. And I think ultimately we do the best we can with the information we have at any one time. And I deeply feel that that is just what parenting is, whether it's breastfeeding, whether it's that they won't sleep through the night, they're having trouble at school, whatever it is that we come up against throughout parenting, we just make the best decision we can with the information and the resources we have at the time. And so that's why, yeah, I shared that story for the first time in the book because I felt like we just needed a more honest conversation around it. You know, existing in the thyroid space as I do, I know all about gut health. I know about physical, mental health and how it's tied into your gut. I know about how breastfeeding can dramatically reduce the chances of so many other health complications and perhaps my own children developing a thyroid condition when they're older. That was in the back of my head as well. My husband also has asthma and eczema, for example. So it was such a big decision for me to breastfeed. But it's not always that straightforward. And that's okay. That's okay. I think mums just need um, more understanding and more just gentleness around that.
Oh, I so agree with you. I know that there's a big movement to talk about how healthy breast milk is and all the benefits, and I'm fully on board with that. At the same time, I think fed is best, and we do want to make sure that we have a plan for a backup plan. For example, we do know, I love the advocacy for breastfeeding, but what a lot of them don't share is that some women actually might not be able to breastfeed because of PCOS or because of thyroid disease. Their breast tissue may not have developed properly. I know I didn't have enough glandular tissue, so I wasn't able to produce enough breast milk. And I had to do some crazy interventions to actually make it happen. But making sure that you have, whether that's the formula or donor milk, and just be prepared because, again, not a lot of times people talk about this, but with thyroid issues, PCOS, we can absolutely have, oversupply, undersupply, and a whole host of issues that come up from breastfeeding. And yes, if we have food sensitivities in our family, then our children might have food sensitivities from the foods that we're eating, right? And that can be something that I feel like can be really, really challenging to go through when you're a new mom and you want to do your best, especially as a first time mom and you've got, all this oxytocin and all these hormones. And, I know I personally I felt terrible. Like I felt like a failure, like I'm not doing my job as a mom. Like this is what I'm supposed to be doing. Why is my body failing me? And I think just stepping back and taking some deep breaths and understanding, we're doing our best and take it one day at a time. And there's so many different options out there. There's so many children that are going to do really, really great. And yes, there are some advantages for breast milk, and you do it if you can, but definitely know that there are other options and very healthy options as well.
Yeah, and I think as well, yes, as you've just said, breast milk is so important for all the health benefits it can give our child. But again, focusing on what is within our control. I know that once my children started weaning, for example, I was looking at probiotic and prebiotic rich foods and looking to nourish their gut in those ways as well, or supplementing with a probiotic for the first year or two of their lives, just to like help to establish that. It will never be exactly the same, but again, we can only focus on what is within our control. And that's so important with our mental health, which ties into how well your thyroid condition is managed. If you're stressed and anxious about so many different things, it's not going to help with the management of your hypothyroidism, your Hashimoto's. Your adrenal health is so important. So yeah, we really want to look at things holistically and realistically as well. When you're a new mum, if you're struggling to breastfeed, if you're struggling to get dinner on the table or to just eat anything all day, we don't need to be adding more to our plate. We need to be taking things off. We need to be simplifying things, and just having compassion for ourselves, especially during that time. So, yeah, I am all about that. And like you say, just making people aware that if you do have a thyroid condition and you're struggling breastfeeding, especially with supply specifically, it can often be due to low thyroid hormone levels. So you want to be assessed for sort of postpartum thyroiditis as well. Your levels could be swinging up and down. We want to be looking at all of that as well. But other times it just doesn't work out for one reason or another. So yeah, it's just I'm very passionate about making sure other people are aware of that, because I think it's so easy to beat ourselves up as new parents.
Oh, absolutely. And I feel like I know you have 2 children and hopefully you go through the process. I know we're talking to every mom in the world about this, but I feel like it does get a little bit easier with time. And you kind of look back and you just want to give yourself a hug, right?
Yes, yeah, exactly. I look back and I just think, oh, what you didn't know then that you know now, and just what, yeah, almost if you can look at yourself through the eyes of someone else. They say to like mother yourself, don't they? What would your mum say if you were your child? What would you want them to do? What would you want them to say and feel right now? And that's just a part of all of it. Because like I say, if we are struggling mentally, or if we're putting all this pressure and stress on ourselves, it makes managing your thyroid health so much trickier. So yeah, it's really a whole jigsaw puzzle.
Yeah. For sure. What about, do you have any messages of hope or suggestions for women who perhaps have Hashimoto's hypothyroidism, and they're trying to conceive? Maybe some words of wisdom or hope?
Yeah, I mean, I would just say, and this is my underlying message in all that I do, to be your own thyroid advocate, advocate for yourself. When I had my miscarriage, I had had a thyroid test a few months before. I assumed things were fine. When I'd had my miscarriage, I by chance had a blood test taken directly after, and my thyroid hormone levels had dropped below range. And I will never know if that was directly caused by the miscarriage, if it perhaps dropped right before I fell pregnant. I just wish I had been more proactive in asking more questions, booking in for those blood tests, learning to be more assertive. I think you are, when you fall pregnant or when you are planning to fall pregnant, you're not only advocating for yourself, you're advocating for your future child, whether you're currently pregnant or hoping to be. And really locking that thought in the forefront of my mind was what drove me to ask the right questions and to not give up hope, essentially, and to keep digging as to why something wasn't working. And in terms of hope, I'm one person that's managed to get through there. I have two very healthy children now. I had fairly straightforward pregnancies. My births were straightforward. Postpartum was as straightforward as it's going to get, with all the sleep deprivation and the tiredness that it brings. But ultimately, we can get there. And I just wish I could speak to the Rachel sort of 5 or 10 years ago when she was starting to think about this and just say, you're going to be fine. It's going to be a lot. It's going to be a tornado, a whirlwind of confusion and feelings, but we're going to navigate it and we're going to get there. And hopefully, that's what this book is going to do for other people in the same sort of situation.
Thank you so much for sharing that and for bringing all this hope. I really wish I had your book when I was first diagnosed with Hashimoto's, just to put myself at ease and to help me understand that yes, you can absolutely get pregnant when you have Hashimoto's, and that it's possible you can do it, and here are some steps to take. Can you tell us a little bit more about your work, where people can find you, where they can find your newest book? I didn't get my copy yet, otherwise I would hold it up and a little show and tell.
That's fine. So the Positive Thyroid Pregnancy Book, you'll be able to find that on Amazon initially, and then it will be going across other retailers soon enough as well. My work, I exist in what I call the thyroid sphere. I talk about all things to do with hypothyroidism and Hashimoto's, primarily what I have learned as a thyroid patient advocate and what I continue to learn and share from sources like yourselves. So you can find me on Facebook, on Instagram. I also have an email newsletter. Just type in The Invisible Hypothyroidism or with Rachel Hill, and I will come up. You'll find me across many formats. But yeah, I have previous books as well over here. So depending on where you are in your diagnosis, different books will be more helpful. Be Your Own Thyroid Advocate is the book I wish I had when I was first diagnosed. You Mean Hypothyroidism is all about navigating your relationships with thyroid disease, the impacts that can have. I co-wrote that with my husband so that his voice was also heard in that as well. And then Thyroid Superhero is to help our children understand what our thyroid condition is and how it impacts us day to day, what medication is, flare days, all of that stuff. So depending on where you are in your journey and what stage you are in your life, I've got a lot of resources that will probably help you. So do come and say hi.
Thank you so much for creating all of these resources. I know how much blood, sweat, and tears goes into creating books. And I mean, just so many women go through relationship challenges with hypothyroidism, with chronic illness. So so love that you and your husband wrote a book about this. I know my husband and I went through our own different healing journeys, and it was a challenge, and I feel like hardly anybody talks about that. And then just getting to speak to our children and getting them to understand what's going on with mom or dad is also super super important. So I appreciate you creating these resources, and this newest one is going to change so many lives. Be sure, everybody listening, to check out Rachel. She does amazing advocacy work. So grateful for her work. And now I'm going to put her on the spot just a little bit. Now that we talked about positive journey to parenthood with thyroid issues, I would love to know, Rachel, if you have any wellness hacks that you refuse to participate in.
Counting calories. So I have a previous history of this eating disorder. So I've been there, I've done that. It made my health so much worse. I primarily focus on getting enough protein and healthy fats for every meal and snack. I build my meals around there. You will see, like in my Instagram stories, I share what I'm having for lunch. I really don't like to overcomplicate things. As I've said before, so many of us are already so busy with work and children. We don't need to overcomplicate how we're eating, but we don't need to be counting calories. Just focus on getting a wide variety of food with the right sort of nutrients and the right focus. Yeah, I'm all for that.
I so appreciate that take too. Um, I, I really appreciate that. In my cookbook, I didn't actually put calories because I feel like that's not necessarily important, especially when you have low metabolism or high metabolism. It's not necessarily going to matter, and you want to make sure you're properly nourishing yourself. So yay for that. If you had the supplement police come to your house and take away every single one of your supplements, but they let you keep one, what would that supplement be?
Oh, right now it would have to be iron bisglycinate because I've still not yet optimized my levels. In general, probably selenium. I think that's that was a big driver in helping to bring my thyroid antibody levels down. And if I fall off of taking it, there've been periods like when I was a new mum that I didn't take it for a few months, and those antibodies start to go up, and I generally genuinely feel that it helps me. So I feel like selenium is a really important one for thyroid health.
That's such a good one. I don't think we talked about that, but it can be a really big game changer. I know that there's studies showing that it can reduce the incidence of postpartum thyroiditis if you do take it throughout pregnancy. Um, a lot of prenatals don't have enough, so really appreciate that you shared that. Do you have any health myths that just drive you crazy?
Probably that we can cure hypothyroidism or Hashimoto's by eating a lot of seaweed, which is probably going to do the opposite effect. There are some people that can reverse Hashimoto's to the point of it being in remission, that they may no longer need thyroid medication if hypothyroidism has a cause that is figured out. I just think for the vast majority, that is not. It's not totally honest and attainable. So I think like just yeah, giving the full picture of it really depends what has led to this diagnosis and what led to the development, and then whether you can cure it with or without a lot of seaweed will be dependent on that. But yeah, there's no like one magic cure that's going to solve it. I think it's a lot more beneficial to look at what caused it. Is there anything we can do about that? I know you talk a lot about root cause, and then how do we manage it going forward?
Yeah, absolutely. And the I struggle with the seaweed and high iodine recommendations. I know for some people, yes, maybe that can be helpful, but for the majority of people, we do know that excess iodine can be triggering of Hashimoto's. And so I always see people like going to their local health food store and it's like, low thyroid, here's some iodine. And it kind of makes sense on paper because, you do need iodine to make thyroid hormone. But when you have Hashimoto's, you've got this inflammatory process, and actually more iodine can be like putting fuel on a fire. And it's
Yeah.
if I say like if people say jogging is good for you, everybody should jog. What if you have a broken leg? Should you be jogging? Like I don't think so, right? Like, if it makes you worse, it makes you worse. And
Yeah.
I think there's a big concern about that. Now, I will say one thing we didn't talk about is I feel like some women also with hypothyroidism might be afraid of iodine, right? Where they might just kind of go the other extreme because they know too much can be problematic. Can we perhaps talk about prenatals and iodine?
Yeah, I think generally, so we do need a certain amount of iodine in pregnancy, and most good quality prenatals will include the amount that you need that will be safe for you. Obviously, we're all individuals, so some people with Hashimoto's specifically will find that they react to iodine in a supplement. You want to run it by your doctor, pass your pharmacist, make sure that there's nothing that's contradicted for you, and at the same time, approach with caution, but generally, if it's a low enough dose that's just meeting that recommended daily amount, you are probably going to be fine. I know I approached it with caution. I'd never taken an iodine supplement before. I was absolutely fine. It was included in my prenatal. We didn't talk about prenatals that much, but generally the advice that I follow and recommend is to find yourself a good quality prenatal, and then basically supplement the extra things that your body needs on top. So a lot of the time they will include a little bit of everything, but most women also need extra iron, vitamin D, things like that on top. So yeah, you want to find a good prenatal that probably includes it, unless you don't get along with iodine specifically, and then look at the other important nutrients as well. Have your levels tested often. With iodine, it's often better safe than sorry to get your levels tested. A lot of people have fine levels. They might even sort of be like borderline high and they really don't need any more and they're just not aware. So similar to iron, it's not one that I would recommend supplementing unless you know that you need it, unless you've got symptoms, a test result has given you that confirmation. Yeah, we don't necessarily need to be really scared of it if we're taking it in small amounts within a prenatal. But any more than that, yeah, you need those considerations for sure.
Thank you so much for sharing that. Yeah, my experience has been that generally the amount that you'll find in a multivitamin or a prenatal is going to be well tolerated and helpful. It won't increase thyroid antibodies, might actually reduce them. But then when we get above like the 500 microgram range, that's when I start to get concerned because people can overdose themselves, right?
Yeah.
Um, what is a guilty pleasure that isn't necessarily like thyroid advocate approved? If somebody was like, wow, is that still the thyroid advocate? Is she really doing that?
um, oh, I don't know really. I suppose I haven't like cut out sugar or processed foods specifically. I try to follow the sort of 80-20 rule. So eating sort of like whole foods, unprocessed 80% of the time, and allowing chocolate and desserts and maybe ice cream, things like that here and there. I'll just try to stick to sort of like once or twice a week. Yeah, I guess a lot of what you see online, especially, is this like curated image of the practices that we want people to be implementing. We're probably not going to show every time we're eating chocolate or an ice cream. Um, but yeah, I don't, for me, like I said before, no food is sort of like off limits unless it's causing me a reaction. So for me, that is gluten, alcohol, and I keep my caffeine really quite low. So I don't drink caffeine, I don't drink coffee. It's just not for me personally. But those are like my dietary things that I stick to. I don't feel the need to remove or like restrict anything else. I just find moderation is best. And my focus is lots of fiber, lots of rainbows, lots of colors. Yeah, that's what I do with diet, but you won't find me entirely avoiding sugar or anything like that.
I feel like that's very healthy advice because a lot of times people can get very, I will share a lot of information about like potential food triggers. And then some people might think they need to avoid every food, or I might share about different supplements and people think that they need every supplement. Then I talked about it. I'm like, no, actually, like these are some things to look into, and you want to figure out what works best for your body. Like I was very dairy sensitive. You might not be, or somebody might be really deficient in B12 and they might need supplements, sublingual or injections, but another person's B12 levels might be just fine. And so, really getting to understand first, thyroid disease, what might happen, second, your own body, and third, how to advocate for yourself. And I feel like this is such an important message. And I feel like you and I both really, really want to get that message across for people to be able to understand their own bodies really, really well so that they can really care the best for themselves.
Yeah, definitely. I think having the information is key. Helping people to implement that is really important. And then above all, we just need to make it accessible and realistic. I think that's the main message. I would just say, just make it accessible and realistic for you. Find a way that you are actually going to implement these things. And like we said, it's less about feeling like we need to cut lots of things out of our diet and throw lots of supplements in. That's probably not going to do a lot. The foundations of just trying to eat a varied diet is going to do so much more for you than cutting 20 things out of your diet. So I'm all about that. I'm a total foodie. I love food. I love new recipes and trying new things. Yeah, I think it's so important.
But would love to know your thoughts if you perhaps had a client that was uncontrolled for years, how would they advocate for themselves?
Yeah, I mean, if you're not yet on thyroid medication, in this kind of example, it might be that you've been told you have subclinical or borderline hypothyroidism. If you're looking then specifically at fertility, that is generally something that your doctor will and should get under condition before you want to start trying to conceive. Um, because we're talking about that specifically today. If you've got any kind of uncontrolled, not very well managed thyroid condition, you absolutely want to do your best to get that to as well a controlled and well managed a place as possible before you even try to conceive. Obviously, if you find out you're pregnant, it's then a case of doing what you can going forward to try and get that under control. So, from the hypothyroid side of things, getting your free T3 or free T4 optimized. Also, pay attention to your TSH, but less so compared to those specific hormone levels. With Hashimoto's, again, as we touched on earlier, the lifestyle factors that can help to reduce those antibodies can be really, really helpful. But yeah, it's a big thing we didn't talk about actually being subclinically hypothyroid. You can feel terrible. A lot of people think if their TSH is only slightly out of range that it doesn't warrant medication. It doesn't warrant anything really. And putting pregnancy and fertility aside, not all people with subclinical hypothyroidism will need treatment. They might be able to get under control before it gets to that point. But as you said, if you're looking at falling pregnant, optimizing your fertility, it absolutely needs addressing.
That's such great advice. And I would say for people that are struggling to get in control, sometimes changing your thyroid medication can be a big deal. I know thyroid hormones interact with like food and supplements, sometimes with your gastric acid if you don't have enough, if you have gastritis, and sometimes tyrosine. I found for people that have uncontrolled hypothyroidism, sometimes that can do the trick of getting them optimized because they put it in a gel cap. So it kind of bypasses all the systems and interactions. Um, so Tammy mentioned her TSH has been 46, and I definitely would encourage her to work with her doctor to try to get that optimized. My experience is typically like point 0.5 to 2 when people feel best. Is that similar what you see in the people that you advocate for?
Yeah, zero point 0.5 up to sort of 2, 2.5, somewhere around there. My TSH being on Armour is generally quite suppressed, so it's usually just ever so slightly below zero point 0.5. I think at my last test it was like 0.45. But yeah, generally a TSH lower is really going to help you out. A TSH of 46, did you say? Yeah, mine's only ever got as high as 9, and I felt absolutely terrible. So I can't imagine how you feel with one that high.
Yeah, definitely I would highly encourage you to check in with your doctor and try to get optimized on that. And sometimes you might need to switch doctors to try to get the right kind of care, and you really deserve that. Um, I definitely think something super important, the TSH can get suppressed with armor. So that's something that people do need to consider, especially, when they are pregnant, that doctors are educated about that, that they do know that different thyroid meds can impact our numbers. So thank you so much for sharing that.
Yeah, I think as well, the pregnancy hormone HCG, which is what you're testing when you take a thyroid test, that can also lead to more suppressed TSH levels. So, yeah, there's a lot to be considered there, and many doctors would prefer you to be on T4 only medication through pregnancy. Not every doctor is confident or happy to monitor someone on NDTs or T3 medications. So, yeah, if you're going into pregnancy already on those, or if you want to go into pregnancy on those, find a doctor that is knowledgeable to stabilize that on you, to stabilize you on that before you go into pregnancy and then beyond. So you want to build a good relationship with a doctor that you feel essentially knows what they're doing with this medication, because it's not sort of typical for doctors to be willingly open to using those medications. So I wouldn't just assume if you want to change medication or you find out later that you would do better on a different medication, do it sooner rather than later.
Thank you. I really appreciate you sharing that. And I feel like this is why it's so important for people to, yes, listen to their doctors, but also make sure that they understand thyroid conditions, the different thyroid meds, and again, their own bodies and how to advocate for themselves. So, thank you so much, Rachel, for being here and for the work that you're doing to support thyroid patients all over the world. On behalf of the thyroid community, I really appreciate you.
Thank you so much for having me. I think it's very much sort of related back to you, the work that you do in terms of Hashimoto specifically. It's so valuable, and I think the more we can get these voices out there, mixture of medical professionals, patients, like all sides of it, hopefully the more we can do just to improve people's quality of lives, and let them know that we don't just have to stay feeling ill. There are things that we can do ourselves as well as working with our doctor. We can take control, we can advocate for ourselves, and yeah, just utilize all of this information that we have out there between ourselves and all these other amazing resources, the other guests you have on your podcast. I've been listening to your episodes the last few nights. There's so much out there, so I do just urge people to take it in, take what matters to them, what makes sense in their situation, and reach out. We have a great thyroid community out there, lots of people that are willing to help as well.
Thank you so much for sharing that. And everybody listening at home, I hope this has been a healing part of your journey. Until next time.